Welcome back, everyone. Today, we'll be taking a deep dive into the world of surgical disorders in newborns.
It's a fascinating area, really.
We're going to be pulling insights from a pretty intense medical textbook, Neosurgical Disorders.
Oh, yeah, that's a classic.
It can get pretty technical, but we'll try to break it down and make it understandable for anyone who is curious about these conditions.
Because whether you're a healthcare professional, a parent, or just someone who loves learning about the human body, understanding these conditions is important.
Exactly. So let's start with something that's pretty fundamental for any newborn: breathing.
Right, that's pretty high on the priority list, right?
It seems so simple, but the book highlights a bunch of conditions that can make breathing a real struggle for these little ones right from the get-go.
Oh, absolutely. And one that might surprise you is called colonal atresia. It's where the back of the nasal passage is blocked.
So, like a stuffy nose, but way worse.
Way worse. The newborn can't breathe through their nose at all.
I can see how that would be a problem, but can't they just breathe through their mouth?
You'd think so, but newborns are what's called obligate nasal breathers, meaning they primarily breathe through their noses, at least for the first few weeks.
So atresia can actually be life-threatening.
Absolutely. And it's fascinating how it's diagnosed. One clue is something called resolving cyanosis.
Resolving cyanosis. That sounds a little scary.
It can be. Cyanosis is when the baby turns blue because they're not getting enough oxygen.
Oh, right.
But with atresia, they might turn blue and then suddenly pink up again when they cry.
Oh, I get it, because when they cry, they're breathing through their mouth.
You got it. It's a tiny detail that can make a huge difference in diagnosis.
Wow, that's incredible. So what can be done about it?
Thankfully, corneal atresia can be treated with surgery. They basically create an opening in the nasal passage.
That's good to hear. Now, moving on, the textbook also mentioned macroglottia. I'm guessing that means big tongue, right?
Bingo. And as you can imagine, a large tongue can cause a whole bunch of problems for a newborn.
I can see how it would make breathing tough, but what else?
Well, feeding can be a challenge. It can lead to poor weight gain, and even speech development can be affected later on.
Wow, so something as simple as tongue size can have a domino effect. How do you even treat that?
It depends how severe it is. Sometimes just positioning the baby in a certain way can help,
Oh, okay.
but other times tongue reduction surgery is needed.
So you have to tailor the approach to each baby's needs. Now, we've talked about blocked nasal passages and big tongues, but there's another anatomical issue that can affect a newborn's breathing: a small lower jaw.
Ah, you mean micronathia?
Yeah, micronathia. What's the problem there?
Well, it's not just the size of the jaw itself, it's how it affects the tongue. With a smaller jaw, the tongue can fall back and block the airway.
Oh, I see.
That's called glossoptosis, and it's often seen in syndromes like Pierre-Robin sequence.
So these syndromes add another layer of complexity to the situation.
Exactly. Managing the airway becomes absolutely critical. It can easily become obstructed.
So how do you deal with that in such a tiny patient?
Sometimes positioning the baby on their tummy or giving them supplemental oxygen is enough.
Okay.
But for severe cases, we might need specialized tools, even a tracheostomy, to keep the airway open.
It's amazing how they've developed such specialized techniques for these situations.
It really is. And in the long term, surgical procedures like attaching the tongue to the lip or reconstructing the jaw might be necessary.
So a combination of immediate actions and long-term solutions. Moving on, let's talk about another vital function for newborns: eating.
Ah, yes. Got to keep those little bellies full.
The textbook mentions something called a laryngeal cleft, which sounds pretty serious.
It is. Basically, it's an abnormal connection between the larynx, the voice box, and the esophagus, the food pipe.
So instead of being separate pathways, there's a chance of food going into the lungs.
Exactly. That's aspiration, and it can lead to all sorts of respiratory problems. Pneumonia, lung damage, you name it.
That sounds terrifying for a newborn.
It is, and the severity can vary depending on how big the cleft is. A minor one might just cause some choking during feeding,
Oh, okay.
but a major cleft, that can cause severe respiratory distress.
So how do you manage a condition where eating is so risky?
Well, diagnosing it usually involves looking directly at the larynx and bronchi. If it's a minor cleft, you might be able to manage it with careful feeding techniques.
Makes sense.
But a major cleft often needs surgical repair. And sometimes even life-saving interventions like ECMO are needed.
ECMO.
It's essentially a heart-lung bypass machine, but for newborns.
Wow. It's amazing how technology can step in when the body isn't working right.
It is. And while we're on the topic of food and eating, there's something else we need to talk about. Esophageal atresia and tracheoesophageal fistula.
Those sounds familiar. They have to do with malformations of the esophagus, right?
Yes, you're on top of it. In esophageal atresia, the esophagus, which carries food from the mouth to the stomach, doesn't form correctly.
So it's like a broken pipe.
Pretty much, it ends in a blind pouch, so food can't reach the stomach, and often it comes with a tracheoesophageal fistula,
Which is?
an abnormal connection between the esophagus and the trachea, the windpipe.
So not only is the food pipe broken, but there's a detour into the airway.
Right. This combination can lead to aspiration, breathing problems, and even a distended abdomen.
So it's like a triple whammy. What can be done?
The good news is these conditions are often suspected before birth using ultrasounds.
Okay.
And once the baby's born, x-rays can confirm the diagnosis. Early treatment is key here.
I'm assuming surgery is the main treatment in these cases.
You bet. The goal is to repair the esophagus, close the fistula, and create a working connection between the esophagus and the stomach.
It's really incredible what surgeons can do these days.
It is. It's mind-blowing. Now, shifting gears a bit, we've discussed the nose, tongue, and esophagus. But what about the windpipe itself? The book talks about tracheomalacia.
Tracheomalacia? I don't think I've heard of that one.
It's a condition where the trachea, the windpipe, is too soft and floppy. It collapses easily, especially when the baby breathes in.
Oh, so like a straw, it collapses when you try to drink from it.
Exactly. It causes noisy breathing, a kind of barking cough, and problems clearing mucus.
I bet that's really distressing for a newborn.
It can be. The good news is, mild cases often resolve on their own.
Oh, good.
But more severe cases might need ventilation support or even surgery.
So many things can affect a newborn's breathing. We've seen how the windpipe can be affected, but what about the diaphragm? That muscle is essential for breathing, right?
Absolutely. And one of the most serious conditions affecting the diaphragm is called congenital diaphragmatic hernia, CDH for short.
CDH?
Yeah, it's a birth defect where the diaphragm doesn't form properly and abdominal organs can move up into the chest cavity.
So instead of staying put in the abdomen, they kind of invade the chest.
You could say that, and that can cause huge problems, especially for the lungs.
Because the abdominal organs take up the space the lungs need.
Exactly. The lungs don't have enough room to grow properly, and that leads to pulmonary hypoplasia,
Which means?
underdeveloped lungs. It's a major problem for newborns who, need to breathe to survive.
That sounds really serious.
It is. These babies often have severe breathing difficulties right after birth and need immediate help.
What kind of help are we talking about?
Well, the first priority is stabilizing their breathing, often with gentle ventilation. Sometimes they even need ECMO. Remember that heart-lung bypass machine?
Right.
And then once the baby is stable, surgery is done to repair the diaphragm and put those abdominal organs back where they belong.
So it's a two-part process. Stabilize, then fix. What happens in the long term?
Even with successful surgery, CDH babies often face challenges. Their lungs might not function as well as they should, and they might need respiratory support. They might also have feeding difficulties and developmental delays.
It sounds like caring for these babies requires a whole team of specialists, not just surgeons.
Oh, absolutely. Surgeons, respiratory therapists, neonatologists, and many others. It takes a village.
Now, the book also mentioned diaphragmatic aventration. Is that related to CDH?
Good catch. They are similar. In diaphragmatic aventration, the diaphragm is weak and bulges up into the chest. But there isn't a hole in it like in CDH.
Okay, so the diaphragm itself is just weak.
Right, and CDH is always present at birth, but aventration can develop later because of nerve injuries or other things.
So what happens when the diaphragm bulges like that?
It depends how severe it is. Some babies have no symptoms at all.
Really?
Yeah. But in more severe cases, the bulge can compress the lungs and make breathing difficult.
Kind of like with CDH, but not as severe.
That's a good way to put it. Treatment also depends on how bad it is. Some babies just need monitoring, while others need surgery to strengthen the diaphragm.
So we've talked about conditions that affect the diaphragm and breathing. Let's shift gears now and talk about lung malformations themselves. First up is congenital pulmonary airway malformations, CPAMs for short.
Yes, CPAMs, they're abnormal growths or cysts that develop in the lungs before birth. They can be tiny, microcystic, or larger, macrocystic.
So basically, abnormal tissue formations in the lungs. What kind of problems do those cause?
One issue is air trapping. The cysts trap air, memming up the normal flow in and out of the lungs. This can overinflate the affected tissue and compress healthy lung tissue.
So the cysts themselves are a problem, but they also impact airflow.
Exactly. In severe cases, they can even lead to hydrops fetalis.
Hydrops fetalis.
It's a serious condition where fluid builds up in the fetus. It can even cause heart failure.
That's scary. So how are CPAMs diagnosed and treated?
They're usually diagnosed before birth through ultrasound,
Okay.
and sometimes a CT scan is done after birth to confirm. Treatment depends on the size and severity. Small ones that aren't causing problems might just need monitoring,
I see.
but larger ones often need surgical removal.
They remove those cysts from the lungs.
Yep, and sometimes they can even do the surgery before birth in utero.
Wow, surgery in utero for lung malformations. That's incredible. Technology's come a long way.
It really has. Now, another condition mentioned in the book is bronchopulmonary sequestration, or BPS.
Bronchopulmonary sequestration. That's a mouthful.
It is, but it's basically a piece of lung tissue that's separated from the normal airway and blood supply, like an island of lung tissue that's cut off from the rest.
So it's like dead space in the lungs.
Pretty much. And sometimes it can get infected and cause problems.
I see. So how's it diagnosed and treated?
Imaging studies, like CT scans, can show the abnormal blood supply to the sequestered tissue. Treatment usually involves surgery to remove that isolated piece.
Another one where surgery is the go-to solution.
Yep. But the good news is BPS is usually a well-defined problem, so surgery is relatively straightforward.
Okay, good. The last lung malformation in the book is congenital lobar emphysema, CLE. What's that one all about?
CLE causes overinflation of one or more lobes of the lungs. It's usually present at birth, and the affected lobe looks bigger and more air-filled on x-rays.
So instead of being normal, the lobe is like puffed up like a balloon.
Exactly. That overinflation can compress surrounding lung tissue, making it hard to breathe.
Kind of like with CPAMs.
Similar, yeah. But in CLE, the overinflation is usually caused by a blocked or narrow airway leading to that lobe.
So air gets trapped and causes the lobe to expand.
You got it. And this can cause breathing problems, especially for newborns.
I see. So how is CLE treated?
Like many of these conditions, it depends on the severity. Mild cases might just need monitoring.
Okay.
But if it's more serious, surgery to remove the affected lobe is often the best option.
Remove a whole lobe of the lung? That seems pretty drastic.
It is major surgery, but the remaining lung tissue usually compensates for the missing lobe. These babies can go on to live healthy lives.
That's amazing how the body can adapt like that. Well, we've covered a lot when it comes to breathing and lung malformations. Let's talk about another category. Abdominal wall defects.
All right?
The first one mentioned is omphalocele. What is that exactly?
It's a birth defect where the intestines and other abdominal organs stick out of the baby's belly button. They're covered by a thin sac, though.
So instead of being inside the abdomen, they're outside.
Yep, and it's important to remember that omphalocele always happens at the belly button, and the organs are always covered by a sac.
Okay, so location and the sac are key features. What causes this to happen?
It happens early in pregnancy when the abdominal wall doesn't close properly. So as the fetus grows, the intestines and organs stay outside.
So a developmental glitch. How serious is it?
It depends on how big the defect is and if there are any other birth defects present.
Oh, so it's not just the omphalocele itself that's a concern.
Right. Some babies with omphalocele also have heart defects, chromosomal abnormalities, or other problems.
So it can be quite complex. How is it treated?
Surgery is the main treatment. Surgeons carefully put the organs back into the abdomen and close the abdominal wall.
It sounds like a delicate procedure. When is the surgery done?
It depends on the size of the omphalocele and the baby's overall health. Sometimes the surgery can be done right after birth, but sometimes a staged approach is needed, especially if the omphalocele is large.
Staged approach, meaning
Multiple surgeries over time. For example, they might use a silo.
a silo.
It's a protective pouch placed over the exposed organs. They gradually tighten the pouch, gently pushing the organs back into the abdomen.
I see.
Once the organs are back inside, they can close the abdominal wall surgically.
Wow, that's quite a process. Now, the book also mentions gastroschisis. How is that different from omphalocele?
They are similar, but in gastroschisis, the intestines stick out through a hole beside the belly button, not through it.
Okay, so the location is a bit different. Anything else?
The biggest difference is that in gastroschisis, there's no protective sac covering the intestines.
So they're just exposed.
Exactly. That makes it more urgent because the intestines are at risk of infection, twisting, and damage.
So I'm guessing surgery is even more critical here.
Absolutely. It's needed right after birth to put the intestines back in and close the abdominal wall.
Wow, these abdominal wall defects are really serious. It's incredible what surgeons can do for these tiny patients.
It really is remarkable. They're true heroes.
They really are. It's amazing what they can accomplish. We've covered a lot of conditions today, from those breathing challenges to these abdominal wall defects. And it's amazing how resilient these tiny humans are.
It really is a testament to how strong they are. And it's not just the surgeons, it's the entire medical team.
Right. The nurses, the neonatologists, the respiratory therapists, everyone plays a vital role. Speaking of advancements, what stands out to you as some of the biggest game changers in neonatal surgery? Things that have really improved outcomes for these little ones.
Well, one big one is the development of neonatal intensive care units, NICUs.
ICUs, yeah.
They provide a highly controlled environment, round-the-clock monitoring, specialized care from a whole team of experts. That level of intensive care has made a huge difference in survival rates for preemies and babies born with these complex conditions.
So the high-tech life support bubble, almost.
Exactly. Another big advancement is minimally invasive surgery, laparoscopy, thoracoscopy, those kinds of things.
Okay, yeah.
Instead of big incisions, they use tiny ones and specialized instruments. Less pain, faster recovery, fewer complications.
So it's not just about fixing the problem, but doing it in a way that minimizes the impact on these tiny babies.
Exactly. And then, of course, there's the ongoing research into fetal surgery.
Fetal surgery, wow.
It's really pushing the boundaries. Now we can intervene in some cases before birth to correct certain defects.
That's incredible. What sorts of conditions can they address with fetal surgery?
Spina bifida is one example. That's where the spinal cord doesn't close completely. They can actually go in and close that defect while the baby is still in the womb.
Wow. It's mind-blowing to think about what's possible these days.
It is, and it gives so much hope to families facing these challenges.
Absolutely. We focus a lot on the surgery itself, but how important is early detection in these cases?
Oh, early detection is crucial. The sooner we identify the problem, the sooner we can intervene, the better the outcome.
Makes sense. So prenatal care and screening are really important.
Absolutely vital. Prenatal ultrasounds and other tests can pick up many of these conditions before birth, which helps us plan for the best possible care. And even after birth, careful observation and quick medical attention are so important.
It's all about a combination of things then. Prenatal screening, early detection, and timely intervention.
You got it. And while we've talked a lot about the medical side of things, we can't forget about the human side.
Right, of course. These families are going through so much.
It's incredibly stressful to have a newborn who needs surgery. Parents are dealing with fear, anxiety, uncertainty about their baby's future. It's a lot to handle.
What kind of support is out there for these families?
There are lots of resources, thankfully. Support groups, counseling services, online communities where they can connect with other families going through the same thing. Having that support network makes a huge difference.
It's so important to remember they're not alone in this.
Exactly. There's help out there, and connecting with others can be incredibly healing.
We've covered a lot of ground in this deep dive, exploring all these different surgical disorders in newborns. What's the one key takeaway you'd want our listeners to remember?
I'd say the most important thing to remember is that there's hope. These conditions can be serious and complex, but with all the advances in medical technology, surgical techniques, and supportive care, more and more of these babies are surviving and thriving.
That's a really important message. We've talked a lot about the conditions themselves, but what about the ethics involved? The ethical considerations that come up when you're talking about surgery in newborns.
That's a great question. There's a lot to think about ethically. One key issue is informed consent.
Right, because the baby can't make decisions for themselves.
Exactly. So it's up to the parents or guardians to make those decisions. And it's crucial to make sure they understand the risks and benefits of any surgery that's being proposed.
So clear communication and making sure parents truly understand is really important.
Absolutely. And it's not just about giving them the facts. It's about supporting them as they process those facts and make decisions that are best for their baby.
I can imagine that's incredibly difficult for parents who are already dealing with so much stress and worry.
It is. That's why the medical team needs to be sensitive, communicate clearly and compassionately, and really involve the parents in the decision-making process every step of the way.
So it's a partnership between the medical team and the family.
Exactly. And each family is different. What feels right for one family might not feel right for another. There's no one-size-fits-all approach.
It's true. Every case is unique.
Another ethical consideration is balancing the potential benefits of surgery against the potential risks. Surgery always has risks, and in newborns, those risks can be even higher.
It's a careful weighing of the pros and cons.
Exactly. And sometimes it's a really tough decision. The medical team has to be honest with families about the risks. There are no guarantees.
I bet those conversations are incredibly difficult for everyone involved.
They are, but they're essential. At the end of the day, the goal is to make decisions that are in the best interests of the baby, considering all the medical and ethical factors.
It's a delicate balance.
It is, and it reminds us that medical care isn't just about science and technology. It's also about compassion, empathy, and respecting each family's values and beliefs.
Well said. This deep dive has been so insightful. It's given us a real glimpse into the world of neonatal surgery, all the incredible advancements and the ethical considerations that come with caring for these tiny patients.
It's been great discussing this with you, and I think as we wrap things up, it's important to emphasize that Even though these surgical disorders can be scary, there's a lot of hope.
There is.
These babies are so resilient, and with the expertise and dedication of their caregivers, they have an incredible chance at a bright future.
It's amazing to see their strength and the commitment of everyone who cares for them.
It really is. And for anyone out there facing a similar journey with their newborn, know that you're not alone. There's support out there, and with the right care, these babies can overcome so much.
It's amazing, isn't it, the strength of these little ones. And it's inspiring to see how far neonatal care has come.
It really is. It's a privilege to witness those tiny miracles every day.
We've covered so much in this deep dive, exploring all sorts of conditions that can affect a newborn's ability to breathe, eat, and grow.
We've seen it all, from the common ones like macroglossia to the rare ones like pharyngeal cleft.
Right. And each condition, each one presents its own set of challenges, not just for the baby, but for the whole family.
Oh, absolutely. And while we've focused on the medical side of things, we can't forget the emotional and psychological impact these conditions have on families. Having a newborn who needs surgery, that's a stressful and often terrifying experience.
It really is. It's hard to imagine what those families go through. What advice would you give to parents facing this kind of situation?
First and foremost, remember you're not alone. There's a whole network of support out there, from other families who've walked this path to the incredible healthcare professionals who are dedicated to helping your baby thrive.
That's so important to remember. You're part of a community.
Exactly. And never be afraid to ask questions. Your healthcare team is there to provide you with all the information you need to help you understand what's going on. Knowledge is power, and the more you understand, the better equipped you'll be to make decisions and be an advocate for your child.
That's great advice. What else?
Take care of yourself. It's easy to get so caught up in caring for your little one that you forget your own needs. But you need to make sure you're eating well, getting enough rest, finding ways to manage your stress.
Right. It's like they say, you can't pour from an empty cup.
Exactly. And don't hesitate to ask for help. You don't have to go through this alone. Lean on your family, your friends, your community. There are people who want to help, so let them.
And remember, there's always hope. Medical science is constantly advancing, and these little ones are incredibly resilient.
Absolutely. With the right care and support, these babies can overcome so much and go on to live full and happy lives.
Well, this has been an incredibly insightful journey into the world of neonatal surgical disorders.
It's been a pleasure exploring this with you.
We've learned about the complexity of these conditions, the amazing advances in treatment, and the importance of early detection, family support, and ethical considerations. We hope this knowledge empowers you to be an advocate for newborns everywhere.
Keep learning and exploring this fascinating field.
Thank you for joining us on this deep dive. Until next time, stay curious. CCMO.